What you'll learn. After you finish this lesson, you will be able to define wound, differentiate between closed and open wounds, identify types of open wounds, treat closed, minor open, and major open wounds. Wounds. A wound is an injury that damages the body's tissues. The two greatest concerns in regards to wounds include excessive bleeding and infection. So it is important for a healthcare worker to know both how to stop or slow bleeding and how to treat a wound properly to prevent infection. Signs of infection. Infections can be very serious. Some infections, like tetanus, can cause death if they are not treated. It is important that healthcare workers be able to recognize the signs of infection so that it can be treated immediately. Signs of infection include redness, swelling, pain, heat, fever, pus, red streaks coming from the wound.
Superficial wounds. Superficial wounds and abrasions should be thoroughly irrigated with a large volume of warm or room temperature potable water, with or without soap, until there is no foreign matter in the wound. Apply antibiotic ointment or cream only if the wound is an abrasion or a superficial injury, and only if the victim has no known allergies to the antibiotic. If a non-occlusive dressing, such as dry gauze dressing, is applied for active bleeding, care must be taken to ensure that saturation of the dressing does not lead to partial or complete occlusion. First aid providers may consider the use of a tourniquet when standard first aid hemorrhage control does not control severe external limb bleeding, but only with proper training. Local cold therapy, such as an instant cold pack, can be useful in cases of bruising or hematoma to the extremity or scalp. However, cold therapy should be used with caution in children because of the risk of hypothermia in this population.
Closed wounds. A closed wound is an injury that causes damage to the tissue under the skin. Closed wounds are caused when the body hits against a blunt object, such as in a bump or fall. Contusions, or bruises, and black eyes are examples of closed wounds. A closed wound will usually heal on its own in a few weeks. Because skin is not broken, there is no external bleeding. Closed wounds are also unlikely to be threatened by infection. Therefore, the treatment for a closed wound is much different than the treatment for an open wound. Procedure for a closed wound. It is important to learn the correct procedure for treating a closed wound. Even though closed wounds will typically heal themselves, there are some things a healthcare worker can do to make the patient more comfortable. Individual agencies may have specific procedures that their employees must follow. The following process is an example of a closed wound procedure that might be found at any agency. Place a cold pack on the bruised area to reduce pain and swelling. If possible, elevate the bruised area. Place pillows or folded blankets or a cloth under the affected area. The area should be higher than the heart. Elevating the injury can reduce or eliminate swelling. Open wounds. An open wound is an injury where the skin or mucous membrane is broken. Open wounds can be caused by a fall or when the body comes in contact with a sharp object. There are several types of open wounds. Click on each item to learn about wounds. Incisions, lacerations, abrasions, punctures, avulsions, amputations. Minor open wounds. Some open wounds are classified as minor wounds. They are shallow and produce very little blood. They are not life-threatening and can be treated at home. However, they must be treated with care. Untreated or improperly treated, minor wounds can become infected or can cause tetanus. Procedure for minor wounds. It is important to learn the correct procedure for treating a minor open wound. Individual agencies may have specific procedures that their employees must follow. The following process is an example of a minor open wound procedure that might be found at an agency. Cleanse your hands. Put on gloves. If gloves are not available, create a barrier between the blood and your skin with plastic wrap, plastic bags, or layers of dressings. Clean the wound with soap, water, and gauze, moving the gauze in a circular motion from the center of the wound out to the outer edge. Repeat this process until the wound is thoroughly clean. Throw gauze away after each pass. When the wound is clean, rinse all of the soap with cool water. Apply a dressing to the wound. Instruct the patient how to recognize symptoms of infection and to get medical attention if any symptoms occur. If the patient has a puncture wound, instruct the patient to see a doctor to get a tetanus shot. If the wound contains foreign bodies, instruct the patient to get professional medical help to remove them. Remove gloves. Cleanse your hands.
Major open wounds. Some open wounds are classified as major or severe wounds. It is important to act quickly when treating a patient with a major wound. A patient can bleed to death in a short period of time. Care for a major wound includes stopping the bleeding and then cleaning and covering. However, because a major open wound causes a lot of bleeding and pain, the healthcare worker should also check the patient's vital signs and watch for signs of shock. A tourniquet may be considered for initial care when a first aid provider is unable to use standard first aid hemorrhage control, such as during a mass casualty incident with a person who has multi-system trauma in an unsafe environment or with a wound that cannot be accessed.
Procedure for major wounds. It is important to learn the correct procedure for treating a major open wound. Individual agencies may have specific procedures that their employees must follow. The following process is an example of a major open wound procedure that might be found at an agency. Perform priority care. Only if necessary for safety, move the patient. Check if the patient is breathing and conscious. Call emergency medical services, EMS. Provide care. Cleanse your hands. Put on gloves. If there are no gloves available, use plastic wrap or thick layers of dressings. Do what you can to avoid any contact between the patient's blood and your skin. Control bleeding by applying direct pressure to the wound using a thick sterile dressing. If a dressing is not available, use your hand or a clean cloth. If there is an object in the wound, apply pressure around the object, not on top of it. Continue to press firmly on the dressing for 5 to 10 minutes. Do not check to see if the bleeding has stopped. If blood seeps through the dressing, place a second layer of dressing on top of it and continue to press. Do not lift the first layer of dressing. Removing the first layer will disturb any blood clots that have formed. Apply a circular bandage, which will provide direct pressure on the wound. Procedure for major wounds. As bleeding stops, slowly release pressure on the pressure point. If bleeding resumes, reapply pressure immediately. Continue pressure as needed until EMS arrives. Monitor the patient for signs of shock. Treat shock if needed. Keep the patient calm. If the injury involves an amputation, prepare the amputated part for transport. Wet a dressing or clean cloth with saline or clean water. Wrap the body part in the dressing or cloth. Place the part in a clean plastic bag. Put ice or cold water in a cooler or any clean container. Make sure you add enough ice or cold water to cover the body part. Put the body part in the cooler or container. Send the amputated part to the hospital with the patient. When help arrives, give the body part to the EMS. If you are driving the patient to the hospital, take the amputated part with you. As soon as possible, remove gloves. As soon as possible, cleanse your hands thoroughly.
Procedure for major wounds. There continues to be no evidence to support the use of pressure points or elevation of an injury to control external bleeding. The use of pressure points or elevation of an extremity to control external bleeding is not indicated. In the first aid situation, it is reasonable to leave an open chest wound exposed to ambient air without a dressing or a seal. Hemostatic dressings may be considered by first aid providers when standard bleeding control is not effective for severe or life-threatening bleeding. Hemostatic dressings are likely of greatest use for severe external bleeding in locations where standard hemorrhage control is not effective, when a tourniquet cannot be applied, trunk or juncational areas such as abdomen or axilla/groin, when a tourniquet is not available, or when a tourniquet is not effective to stop bleeding.
Lesson summary. In this lesson, you learned about wounds. You learned about the types of wounds and how to treat them. Then you practiced the procedures for treating wounds. In this lesson, you learned that a wound is an injury that damages the body's tissues. A closed wound is an injury that causes damage to the tissue under the skin. A minor open wound is an injury where the skin or mucous membrane is broken. It is shallow and produces very little blood. A major open wound is a serious injury where the skin or mucous membrane is broken and it causes a lot of bleeding and pain.
What you'll learn. After you finish this lesson, you will be able to define a burn. Identify types of burns. Classify burns as first degree, second degree, or third degree. Demonstrate how to treat a burn. Burns. A burn is an injury caused by fire, heat, chemicals, radiation, or electricity. Burns are traumatic in that they can cause extreme pain, permanent disfigurement, psychological problems, and even death. The three types of burns are thermal, chemical, and electrical. And there are three classifications of burns. They are first degree, second degree, and third degree. In addition to type and classification, burns can also be described by extent and severity of the injury.
Types of burns. Types of burns include thermal, chemical, and electrical. Thermal burns are perhaps the most common. They are caused by house fires and car accidents. They can also be caused by playing with matches and firecrackers. Other thermal burns are caused by scalding water, irons, stoves, and sunburn. Chemical burns are caused by contact with acids or alkaline. Contact includes ingesting, inhalation, and injection. People who work with harmful chemicals must take precautions to avoid contact with the skin or inhalation of dangerous fumes. Electrical burns are caused by faulty electrical wiring, chewing on electrical cords, high voltage power lines, and the rare occurrence of lightning strikes. Electrical burns can pose a unique problem for healthcare workers. Treatment depends on whether or not the patient needs to be separated from the electrical source. A person who touches a live wire is often unable to let go. In this case, the patient needs to be carefully separated from the electrical source using a non-conductive material, such as plastic, wood, or cardboard. Conductive material, such as a person's hand or metal, should never be used. Using conductive material will result in the caregiver becoming electrocuted as well. Turn off the power at its source. At home, the switch is usually near the fuse box. In case of high voltage electrocutions caused by fallen power lines, immediately notify the appropriate authorities, e.g. 911 or fire department. All materials conduct electricity if the voltage is high enough, so do not enter the area around the victim or try to remove wires or other materials with any object, including a wooden one, until the power has been turned off by knowledgeable personnel. Once the power is off, assess the victim, who may need CPR, defibrillation, and treatment for shock and thermal burns. All victims of electric shock require medical assessment because the extent of injury may not be apparent.
First-degree burns. First-degree burns are also called superficial burns. The first-degree burn is the most mild of classifications. It is a shallow burn that damages only the first layer of skin, called the epidermis. Symptoms of first-degree burns include hot, red, dry skin, mild swelling, and some pain. Causes of first-degree burns are sunburn and brief contact with hot objects, steam, or weak acids. Usually, a first-degree burn on a small area of the body is not serious and will heal in 5 to 6 days without leaving permanent scars. Second-degree burns. Second-degree burns are also called partial thickness burns. This type of burn affects both layers of skin, the epidermis and the dermis. Symptoms of a second-degree burn include a blister or vesicle. Skin may appear wet and mottled. Swelling or edema likely occurs. Causes of second-degree burns include exposure to boiling liquid, fire, extreme sunburn, and artificial radiation. Second-degree burns are very painful and may take 3 to 4 weeks to heal. Third-degree burns. Third-degree burns are also called full-thickness burns. This type is called a full-thickness burn because it is the deepest or thickest kind of burn. It affects both layers of skin and the tissues beneath the skin, known as subcutaneous tissue. The muscles and bones beneath the tissue might also be affected. Symptoms of a third-degree burn include skin that appears either white or charred. Charred skin has a black, brown, or red color. Causes of third-degree burns include fire and flames, extended contact with a hot object, exposure to electricity, and immersion in a boiling substance. A third-degree burn is a very serious injury that can be fatal. These injuries range from extremely painful to almost painless if nerve endings are destroyed. The patient's skin is too badly damaged to heal and may require skin grafts. This type of burn may also cause other health complications. Patients may have breathing or heart problems, or they may go into shock. Any patient with a third-degree burn should receive professional medical care. Extent and severity of burns. Burns are also categorized based on the extent and severity of the injury. The rule of nines and the Lund and Browder chart are methods that estimate the percentage of the body surface area, called BSA, that has been affected by the burn. With the rule of nines, an adult patient should get professional medical care if burns cover more than 15% of the body. Children if burns cover more than 10%. The percentage is determined by comparing the burn pattern on the patient to the rule of nines chart model and then adding the percentages to get a total. For example, an adult with a burn on the front of one leg and the front and back of one arm would have a burn percentage of 18%. This patient should see a medical professional. Another method for categorizing burns is a combination of the burn's depth and its size. Depth refers to first, second, or third degree. Size refers to BSA. This method classifies burns as minor, moderate, or major.
Procedure for burns. It is important to learn the correct procedure for treating burns. Individual agencies may have specific procedures that their employees must follow. The following process is an example of a burn procedure that might be found at any agency. 1. In all burn cases, perform priority care. Only if necessary for safety, move the patient. Check if the patient is breathing and conscious. If needed, call Emergency Medical Services, EMS. Provide care. Control bleeding, wear gloves, or avoid contact between the patient's blood and your skin. 2. Inspect the burned area to determine if it is a first, second, or third degree burn. Patients may have more than one type of burn. Treat the patient according to the most severely burned area. Procedure for burns. If the patient has a first degree or mild second degree burn, do the following. Run cool water over the burned area. If large amounts of cool water are not available, apply a clean cloth that has been wet with cool water or a cool, not freezing compress. A cool compress can be useful as a substitute for cooling thermal burns. Care should be taken to monitor for hypothermia when cooling large burns, especially for young children. 1. Continue to apply cool water for at least 10 minutes. 2. Blot the area dry. Apply a non-adhesive or non-stick sterile dressing that will not stick to the burned area. 1. If there are blisters on the burn, do not open them. 2. Elevate the burned area to reduce swelling. Call EMS if any of the following have occurred. Burns are on the face. Burns cover more than 15% of an adult's body, or 10% of a child's body. Patient has trouble breathing. Patient shows signs of shock. Call EMS as needed. Procedure for burns. If the patient has a severe second-degree burn or any third-degree burn, do the following. Immediately call EMS. Cover the burned area with thick, sterile dressings. Do not remove any clothing that has become attached to the burned area. Elevate the burned areas if possible. If the face is burned or the patient has trouble breathing, elevate the head. Watch the patient for symptoms of shock. Treat for shock if needed. Keep the patient calm until help arrives. Procedure for burns. If the patient has a chemical burn, do the following. 1. Immediately call EMS. 2. Pour water on the burned area for 15 or 30 minutes, or until EMS arrives. If possible, remove clothing or jewelry that has the chemical on it. Keep the patient calm until help arrives. If the patient has a chemical or gas burn in the eyes, do the following. 1. Immediately call EMS. 2. Ask patient to quickly remove glasses or contact lenses if they are wearing them. 3. Turn the patient's head toward the injured side. Pour cool water on the eye so that it flows from the side closest to the nose to the side closest to the ear. Continue rinsing the eye for 15 to 30 minutes or until EMS arrives. Be careful to avoid rinsing the chemicals into the uninjured eye. Watch the patient for symptoms of shock. Treat for shock if needed. Keep the patient calm until help arrives.
Lesson summary. In this lesson, you learned about burns. You learned about types and classifications of burns. And you learned the treatment for several types of burns. In this lesson, you learned that a burn is an injury caused by fire, heat, chemicals, radiation, and electricity. The three types of burns are thermal, chemical, and electrical. First-degree burns are also called superficial burns. This type is a shallow burn that damages only the first layer of skin. Second-degree burns are also called partial thickness burns. This type affects both layers of skin. Third-degree burns are also called full-thickness burns. This type affects both layers of skin and the tissues beneath the skin. The muscles and bones beneath the tissue might also be affected.